Several years ago, we went back in the literature and actually found out that up to 40% of one's health outcomes are related not to medical care, but actually to these social determinants of health,
such as transportation, education, housing, employment, and other social services. Careapp was a community initiative to address the social determinants of health in our current healthcare delivery system. This is the single tool where all community agents can actually communicate so that the community as a whole is taking care of one client.
We all want to provide the best service that we can, and in these modern times, the faster we do it, the better it is for us and the client.
These are vulnerable and high-risk population receiving the services that they so desperately need, and being able to link them in an efficient manner is a dream come true.
Currently, individual agencies see a client provide services within their walls and within their own staff's knowledge base. Careapp actually allows the community as a whole to understand what the needs of the client are and what services the client is receiving or not receiving.
It connects community resources together and to create a fluidity of linkages and referrals.
The software is actually very user-friendly. For those of us who have used electronic medical records in the medical field, this is easier. For those that are familiar with Google and Google searches, this is no different than that.
We're kind of moving away from working hard, but working smart. And Careapp allows us to work smart and to even serve a greater number of people within a shorter space of time.
As a client sees one of our partner organizations, they're able to electronically keep notes in the database that are shared with other providers within the network.
We can identify what a client is actually receiving. We can then figure out what they're not receiving and how do we close those gaps to ensure then that together as partners, we're doing everything we can to get the great health outcomes and the great human service resources and connectivity that the client really needs.
One instance, I had a client that came in. We provided transportation resources to said client, but he needed more generalized transportation, things that our program wasn't going to be able to facilitate. We were able to search for a provider in Careapp, make the linkages that way, and matter of fact, within 24 hours or so, the client was called and serviced and off on his way.
The platform allows the users to have a live searchable database, meaning that resources are put into the platform directory and updated every 6 months.
What Careapp does is put all those things into one area where you can ask it, this is what I'm looking for, this is where I need it, and it puts it all in one spot for you.
I do not speak English. However, the Careapp provider referred me to the appropriate outside care program.
One great thing about Careapp is the bi-directional referral system. It allows you to track the patient's status. If you notice that the patient has not been taken care of, then you can contact that patient and find out what's going on.
When she helped me and she seen that something wasn't right, she was back on it. To me, it helps the provider go above and beyond with the assistance.
The bottom line is we're trying to increase our screenings for the residents in Howard County. This is a way to achieve that.
The goal for Careapp would be that all service agencies within Howard County become one of the network partners so that any client that walks in their door is able to access services, and that we as a community would know what the client needs and adapt to fulfill the needs of the client for these services.
And if this system is going to improve productivity on behalf of your institution, then I think it would be a good thing to adopt.
Come to the table and give it a shot because it is a great opportunity to improve the outcomes for the county.